Today's episode of Healthcare Hacks is about unintended consequences. I'll tell a quick story. Back in 1998, Frito-Lay's introduced a new chip called Wow potato chips. The thing about Wow was they're fat-free. Great idea. However, they had an unintended consequence. You see, they had an ingredient called olestra, which caused some, let's just say, GI issues for some of its users. Well, why do I bring this up? Well, in this episode, I want to talk to brokers and consultants who are dealing with reference-based pricing plans. They have some unintended consequences that you need to know before you talk to your clients. Hi, my name is John. I'm your healthcare hacker, and I had Wow potato chips one time, and only one time in my life. Before we get started on this episode of Healthcare Hacks, please take a minute, like this video, subscribe to our channel, feed the algorithm. It helps Athos Health reach as many people as possible, and we want to get our message out there because we're trying to help the consumer navigate our complex U.S. healthcare system. So I know many of you around reference-based pricing plans or know what they are, but just in summary for those that aren't as familiar, they're basically commercial plans that allow the consumer to go to a provider, and the price is some multiple of Medicare rates. So 125%, 250%, it kind of depends. Now, in theory, the idea is this is going to lower costs because your traditional commercial insurance plan with a network just typically has a higher cost for the same service. You know, it's 5 times Medicare, 4 times Medicare. So if you can get this lower rate, you're going to save the plan and the consumer money. But that was in theory. In practice, there's a big problem. And that problem focuses around the fact that these types of plans do not have networks. Now, that leads to 2 issues. One is the consumer can get balanced billed. Basically, if the plan pays 250% of Medicare, the consumer can get billed the difference between that and charges. Now, many plans have ways to deal with that. The consumer just has to call, say they can balance billed, and then negotiate a rate that holds the consumer harmless, which is great. However, there's a second problem about not having a network with these reference-based pricing plans, which is a little bit more hidden, and that's around denials. You see, if you have a network, oftentimes the consumer, the employer, doesn't have to pay for the denial. It's up to the provider. Let me give you an example I was just dealing with. An individual went in for a colonoscopy. It was diagnostic. They were not feeling well. They had some GI issues. The doctor wanted to see what was going on. However, when the provider sent in the claim, they miscoded it, mischarged it. They put it as a screening colonoscopy. Well, the insurance company denied it. They said, wait, you said it's screening colonoscopy, but there's sick issues. What's going on? So we're not going to pay this. Now, in traditional insurance, if you had a big plan out there and that was an in-network provider, the member wouldn't owe anything. The claim would be denied. However, it would be up for the provider to fix it. And if the provider did not fix it by contract, that employee, that member, wouldn't have to pay anything. Now, with reference-based pricing, it's a little different. If that same thing happens and it's denied, it's up to the member to fix. Because on that EOB, it's going to show that the member is responsible for the full charges. So they're going to have to call the provider, try to get it overturned. And if they can't overturn, they're going to get stuck with this giant bill, and there's very little that they can do about it. So the lack of that network is basically a protection for your employees that are removed. My point of bringing this up is if you're making a recommendation as a broker or consultant around reference-based pricing, just be aware of this. Because if you're not, you're probably going to get calls about people who have denied services, what's going on, why is the employee responsible? You're going to have some really upset customers potentially. Just be really careful if you're recommending a reference-based pricing health plan to one of your customers. It can come back to bite you. If you have any questions or comments about this episode or anything around the financial side of healthcare, please leave them in the comments below or directly message us. We're happy to answer any questions you have, and we might even cover them in a future episode of Healthcare Hacks. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.